Hi, everyone. I'm Candice Coleman Pope, and this is my Six Pillars case study. So I'm just going to share my screen and go ahead and pull open my PowerPoint. I am just getting familiar with navigating all of this advanced technology. So thank you so much for your patience. Okay. All right. So, my case study is on a 54-year-old male patient. So, he came in as a brand new patient to me. Unbeknownst to him, he thought that this was going to be a very transactional type of relationship where he came in getting refills of his medications as he had recently moved to the area. But I always tell all my friends and my colleagues and my family members, the more that you know about lifestyle interventions, functional medicine, integrative health modalities, there's no turning back. So you can't treat patients the same. It can't be just a simple, you're coming in, I'm giving you a prescription. I don't have it in me to practice that way. So this young man at 54 years old has been on disability for 3 years for a work-related injury. I do something with all of my patients called a comprehensive intake form. So I ask a lot of questions in that form about their overall aspect of their health, a lot of social emotional questions. I ask about connections, dietary habits. I ask about sleep. So all of our really six pillar pattern types I ask in my intake form. And I also do something called a medical symptom questionnaire. So it'll give me a calculated score on how significant the patient's current symptoms are impacting their overall quality of life. And for this gentleman, he has a past medical history of a lot of the run-of-the-mill conditions we see every single day in practice: hypertension, hyperlipidemia, prediabetes, tobacco abuse. He's an active 1 pack a day smoker. He's got about a 30-pack-year history. He does have a diagnosis of COPD. I did not have his most recent PFT test, but I requested that. Again, I was seeing him for the first time. He has a history of insomnia, but did not report any prior evaluation of his disrupted sleep patterns. And then his chronic pain. He was also in need of a referral to get updated with his pain management physician he was following with every 3 months, and receiving medications as well as steroidal injections. So current medications, he's on losartan with hydrochlorothiazide, he's on a statin, he's on metformin, he's on trazodone for the sleep, he's using a Trelegy, Ellipta. He was not rinsing his mouth really well, unfortunately, after the use of that medication. He's on gabapentin 3 times a day. He's been on meloxicam chronically, actually, and then Ultram as well. So the recommendations for this gentleman, I did refill the medicines that needed to be refilled, the ones that I would take care of. The pain management doctor is going to do the gabapentin, the meloxicam, and the Ultram. But of course, what's going to be vitally important for me is to really connect with him and implement some individualized lifestyle medicine modalities to get his trajectory of future health really set on a different path. Because at 54 years old, with the medicines that he's on, the diagnosis codes that are with this visit, we're not heading in the correct direction at all. So the first thing that I felt was most paramount to really address would be stress. And when I say stress, I mean not only the psychological stress that is bidirectional with living and dealing with chronic pain, which there's so much social emotional connection there, but also the physiologic stress on the body of dealing with inflammatory conditions and chronic pain. So what we want to do, I utilize this pain management workbook in practice quite a bit. It's by Dr. Rachel Zoffner, and she really talks about cognitive behavioral modalities to try to disrupt that pain cascade. She does a lot of emphasis on meditation and, yes, pain medicines. It's not a book to say, oh, you shouldn't be on pain medicine, not at all, but it does go into the pathophysiology of pain and the receptors that are perceiving that pain and the perceived stress scale, which I did include on this slide. So getting that patient to acknowledge that deep breathing techniques, changing their mindset can influence their overall pain perception, really empowers them to make some changes with what's going on with their pain on a daily basis. Very sadly, this patient had never been referred to any type of adjunctive therapies, which I thought was quite shocking. He had never done any type of physical therapy, any chiropractic work, no acupuncture. It was an immediate referral to pain management, who started him on pharmacologics and then has since done 2 lumbar steroidal injections. So I'm a big advocate of using some of those adjunctive modalities. We talked about acupuncture, which he was open to and his insurance did cover. So I placed a referral there. This is a QR code on the slide that is a passive muscle relaxation guided type of practice to kind of de-escalate periods of feeling tense. We talked about finding and looking for gratitude every single day. And sometimes when you're in a chronic pain spiral, it's very difficult to try to find anything positive at all. So I kind of challenged him. I asked him, to tell me just 3 good things. And, he was like, well, when you feel my medicine, that'll be good. And he was so really conditioned to be so reliant on this pharmacologic that he didn't consider any other things. He had a really good support person that was present for the appointment and has been by his side through this entire journey. And, he was so honed in and focused just on the pain. So we talked about implementing other patterns of behavior to disrupt this cycle of stress. So the next area, again, he's an active smoker. So we talked a little bit about, I can't disrupt the pain that he's experiencing. So as his provider, it's going to be my job to partner with him to try to mitigate every other area of exposure that's creating that cascade of inflammation and intensifying the pain that he's experiencing. So we talked about this, another vicious cycle of smoking. As soon as you smoke, you get that tiny little analgesic effect. But unfortunately, you're creating that rebound oxidative stress. So, you're kind of lighting the fire, if you will, on your receptors. And unfortunately, the more you smoke, the more you're going to need to smoke. So it's just this, again, cycle of interdependent relationship. The more pain you experience, the more cigarettes you're going to consume. There's also a correlation with opioid use and tobacco abuse, a correlation there. So we talked about if he's ever been open to considering any cessation efforts. I just met him for the first time, so I just gave him a little bit of literature on it and tried to help him kind of be aware of the implications of that. And then again, just telling him, I want to partner with you and I really want to stop other areas that are influencing your pain. That's my job. My job is to try to, really extend and improve your overall quality of life. So smoking cessation for sure. And then we talked about, I'm meeting him for the first time. So I don't want to straight off the gate say, oh, it's my goal to cut off all of your controlled substances. But we did talk about other modalities. I talked to him about, yes, some of the integrative practices like doing meditation, doing acupuncture, which he was open to and got a referral for. But then also we talked about, how your body develops a level of tolerance. And unfortunately, the higher you go with controlled substances, the higher chance you are to have a event, a development of addiction and experiencing withdrawal. So we talked about some other things that we could consider, like maybe a antidepressant to kind of calm down some of those responses that are going through his body. We talked about some of the CDC's recommendations for chronic pain, which I also put on this QR code. The next thing that we discussed was incorporating daily movement. So again, he's been out on disability. His partner goes to work for 8 to 9 hours per day. So he has an extremely sedentary lifestyle. And we talked about the importance of him getting outside, not only because as he moves and lubricates his body a little bit, it will help with some of the pain that's being experienced, but also again for that mind-body connection. And he has disrupted sleep. So preferably, I'd love for him to commit to starting out his day outside, getting natural light to improve his mental, emotional, and physical state of health. So with him, he did have a dog, so he was open to considering a fit prescription that included just making a pattern of behavior, based on where he is with his exertion right now. We would go with just a light intensity. So I'm only asking for him to commit to 4 days a week where he could go outside for 10 minutes to start the day. And then after dinner, his partner said, yeah, I can definitely do that with you. So that was going to be something that they were going to do together, which I thought was fantastic. And then again, as we talked about, really trying to disrupt everything that could be influencing his overall pain, his sleep is so significant. So he suffered from disrupted sleep patterns his entire life, and unfortunately did not practice a lot of healthy sleep hygiene as part of my intake. So we talked about just some easy tips. This is from the American College of Lifestyle Medicine in our reading. So I did supply him with this, as well as talking about doing some diagnostic workup. So using the stop bang score, he did have reported snoring, tiredness throughout the day. His partner has observed apneas. He is hypertensive. His BMI is over 35. He's over 50 years of age, and he's a male. So his stop bang score is a 7, which is indicative of potentially moderate to severe apnea. So with his pain, we decided to do a home sleep study. So I did order that, and that analysis would be incredibly important. I shared with him how having that disruption in his sleep, unbeknownst to him, if his airway is being obstructed, he's already a smoker with COPD. So we already know that oxygen circulation is a little compromised. And then if we have these obstructive events in the middle of the night, his heart doesn't know what's going on. It just knows I've got to compensate, right? I've got to work harder, circulate more oxygen-rich blood through the body. So that's also creating an added stressful state in the middle of the night. So this would be really important for us to focus our efforts on. Again, we're trying to, that allostatic load, we're trying to balance everything and reduce all of those things that are adding on to his overall perceived physiologic stress. So we'll do that. And then utilizing food as medicine. So unfortunately, with his intake forms, he eats a very processed diet, easy, quick things that you can just pop in the microwave. So we talked about how food informs your body. So I had labs that he did bring with him from a prior physician like a year ago, and he had prediabetes. Unfortunately, they did not check anything like a fasting insulin level, but his A1C at the time was at 6.2. So I was trying to explain to him, food, if you're having these peaks and troughs with your blood sugars, that's also creating that same chemical reaction that is putting your body at a state of stress. So we want to try to use food as fuel, and everything that you're putting in your mouth, you want to consider, okay, is this serving me well? So really trying to reach for things that are anti-inflammatory, like oxidant rich foods, and maybe making something fun out of this, trying to incorporate as many colors into the diet as you possibly can. So I asked him if he would be open to considering limiting certain things. And sometimes I do ask my patients, depending on their intake form, depending on that interaction with them, if you feel like you're comfortable asking them to commit to just giving me like a good solid 3 weeks of adding in water. He's not drinking a lot of water throughout the day. He's a soda and coffee drinker. So we talked about decreasing sugar in the diet, specifically through hydrated sugar, getting rid of sodas completely, and trying to incorporate extra fruits and vegetables, very much limit things that have a lot of inflammatory burden. So he was open to cutting back on sugars. He was open to getting rid of gluten, because sometimes that can be very pro-inflammatory. Sometimes I will ask patients to get rid of dairy, which he was also open to, and then just try to lean in on things that are real food, fruits, vegetables, nuts, seeds, healthy fats. The next thing that we talked about is connection. So he did have a partner that's present, but throughout the day, he's just not socially connected. He hasn't worked for 3 years. On his intake forms, doesn't have a lot of interpersonal relationships. So we explored ways to try to get him involved and correlated with others, maybe considering doing something like a group support, or he does have a dog, so just taking time to really be with your dog, go to the dog park, be creative in identifying ways for connection, because that's also going to influence your overall happiness, which is going to inform what's going on with the status of your health. It's one body. So all of these things are completely interrelated. So implementing the power of lifestyle medicine, I'm excited to see what changes unfold for this particular patient. And I really thank you for your attention and allowing me to present this case. Thank you so much.